I've gotten some questions about using Ozempic or Wegovy for chronic pain, and I've seen numerous online discussions on that question. So I wanted to talk about whether or not it's a good idea from a scientific perspective. So let's talk about that for a few minutes. So Ozempic and Wegovy are trade names for semaglutide, which is a glucagon-like peptide 1 agonist or a GLP-1 agonist. And these drugs increase insulin, which helps with type 2 diabetes and can cause significant weight loss. And most of the popular discussions are about using it for weight loss. So when we're talking about these drugs, I can say Ozempic or Wegovy, I can say semaglutide, or we can say GLP-1 agonists. I'm mostly going to say semaglutide because that covers the drugs that are most discussed currently. So to start, why would anyone suggest that semaglutide can reduce chronic pain? Well, it's because it does reduce chronic pain. And there are at least three main pathways for that effect. First, as you might could guess, if you reduce weight, you're going to reduce the load on your joints, like especially your knees, for example. And so that's going to lower pain, no surprise there. Second, as you reduce adipose tissue, you reduce systemic inflammation. Adipose tissue is inflammatory, and when you lower adipose tissue, your C-reactive protein and your other inflammatory markers are probably going to decrease, and this is going to lower inflammatory type pain. So this will be joint and muscle aches and pains throughout your body. Now, third, and what's most interesting to me, semaglutide pushes microglia that are in your brain from an inflammatory state to an anti-inflammatory state. And if you follow my channel, you know that this is very important in combating fibromyalgia type pain and chronic fatigue. And this effect is really well known, and there's over 100 studies looking at the effects of drugs like semaglutide on microglia activity and neuroinflammation. Semaglutide clearly has a beneficial effect on neuroinflammation. It's shown promise in treating asthma and stroke and Alzheimer's and Parkinson's and neurocognitive disorders of various types and neuropathic pain and fibromyalgia type pain and mood disorders and other chronic conditions that are driven by brain inflammation. Now, there's one really big caveat, which is all the semaglutide and microglia studies I know of are in animal models and they're not in humans. So there's still another step that needs to be taken before these drugs are prescribed for neuroinflammatory conditions. So what this means is if you and your primary care physician have decided that you should try semaglutide for your type 2 diabetes, you can expect it will also relieve your chronic pain and maybe your chronic fatigue. This is just an added benefit of taking this medication that's completely separate from what it's doing to your insulin and glucose control and weight loss. So great. I would expect the effects on microglia-driven pain to take about 3 months before it's really noticeable. You might start to feel effects at about a month, but it'll probably take about 3 months to really know if that drug is going to reduce your chronic pain. So it's not a immediate effect when you start taking the medication. All right. So then the big question is, should people who don't have type 2 diabetes or they don't have medically significant obesity, should they try semaglutide for their chronic pain and their chronic fatigue? Answer is absolutely no. If you are in a normal weight range and you have normal insulin and glucose levels, there's not a shred of human data suggesting that this is a good idea. If a paper gets published that changes things, I will certainly talk about it on this channel. But right now, the known risks of semaglutide far outweigh the known benefits for controlling neuroinflammation. So there's too much of a risk of a reduction of your bone density, your muscle tissue, that these are lowered to an unhealthy amount. And there's several other gastrointestinal adverse effects and other issues that you want to avoid. So if you want to target microglia and neuroinflammation, which I think is a good idea, there are better options. And you can follow this channel if you want to hear more about the things that you could take that probably have fewer side effects and adverse events, but they still reduce central inflammation. So bottom line, this is it's an exciting line of research. It's really impressive how many neurodegenerative and neuroinflammatory disorders are helped with semaglutide. I'm certainly going to keep a really close eye on this research. I hope at some point it gets brought over into human participants so we can have even more relevant information. Am I going to run a clinical trial of semaglutide for chronic pain and fatigue myself? No, this is way down on my list. As you probably know, if you track my videos, I have a huge list of things I want to try. Semaglutide is nowhere near the top of that list. But hopefully, this research will lead to improved medications for neurodegenerative and neuroinflammatory disorders, and that would be great. So that's my answer. Should you use semaglutide, Ozempic, or Wegovy for chronic pain fatigue? No, you should not. Um, I'm hesitating a little bit. I want to make, I guess I will. I want to make one more comment. It's kind of an aside from the main topic. Right. So when I was reading the discussions earlier today, I saw that people were getting semaglutide in ways that didn't involve their primary care physician or their endocrinologist. And it was typically when they were getting it for weight loss. And I just wanted to note to everyone that getting these drugs on your own is dangerous. There are contraindications, there are drug interactions, there are many physiological parameters that should be monitored while you're on this drug. There is a liver panel, kidney panel. You should be testing your pancreatic hormones. You should probably be looking at lipids and your immune profile, your complete blood count. And also, I think if someone's taking semaglutide, they should also do occasional DEXA or DXA body composition scans to make sure that they're not losing too much bone density or muscle tissue. So semaglutide is really a drug that needs proper medical supervision, and hopefully your physician is monitoring all the important health markers if you're on that drug. So that's all I have to say for today. I hope that's helpful. I wish all of you well, and I will be back really soon.